My name is Vishaal Kishore. I'm a Professor of Innovation and Public Policy at RMIT in Melbourne. I'm the Executive Chair of the RMIT-Cisco Health Transformation Lab and RMIT's Director of Impact. The National Industry Innovation Network, or NIIN, is a collection of universities from across the country. Flinders University, University of Canberra, Curtin University, QUT, University of the Sunshine Coast, and surely others that I have missed, as well as RMIT. We're anchored by Cisco and a number of other corporates. The idea is to bring a network of insight and expertise to solve national level challenges. The Health Alliance within the NIIN focuses specifically on health-related challenges. It's the first vertical focus within the NIIN, and it's essentially a machine to solve tomorrow's health challenges today.
We have a long and very successful partnership with RMIT. Today's another fantastic milestone in that journey. We are evolving the partnership with RMIT to include in the National Industry Innovation Network, or NIIN.
The sandbox here is a digitally rich collaboration and prototyping studio. As you can see, there are so many amazing technologies to draw from, and the possibilities are limitless in terms of these articulate spaces that are also designed for privacy and security.
We're really excited to say we're open, we're ready to collaborate with you to create new digital and hybrid futures for aged care and for healthcare, in which digitization can clasp hands with respect and connection can drive improvement.
A really crucial part of what we do is interface with users. So here at RMIT, we are a university of design, innovation, and enterprise. And design is written deep into our DNA. And so that the design moment, actually engaging with users, getting their views early, not building and hoping that they will come, but building for what they need, is a crucial part of what we do at the lab and what the broader NIIN Health Alliance does as well. So we have several different interventions. We've done some work in aged care, for example, where we had aged care clients, but then also clinicians coming through and telling us what would work and not work in respect of particular kinds of technologies. We've partnered with providers who have given us access to their clients and their patients to try different kinds of technologies. Would it really work the way that we might hope it would work? Sometimes we learn, yes, it does. Sometimes we learn absolutely not. And so very early, we try to bring in that user group, those patient groups, and to get that viewpoint. Because really, no idea is actually going to have traction in health, or at least it shouldn't have traction in health, unless the people who are going to use it get a voice and have their say in how these technologies develop. The NIIN Health Alliance sat down and we thought together about what will make a big difference in the health system. What is it that our systems need right now? And we thought, in the swirl of new technologies and new ideas about the future of health, we needed to have a sense of where are we going as a health system? What are the technologies that are going to matter? And so collectively, we decided that a trends report would be crucial to helping us to chart out an agenda for the coming year and then the coming 3 years as we think as an alliance together about how we can have an impact in health. We looked at about nearly 10,000 different articles, reports, etc. about the future of health. Our idea was to look at those reports and distill the most urgent trends that are affecting the future of our health systems. What are the main technologies that we need to be ready for? So we've done that work, but crucially, we've done it in a way that aims to be clear about what is it that health system players can do today in the next 12 months to get ready for these trends. What are the trends? So the most hyped trend of 2023 and 24 is surely AI. So we've looked carefully at the implications of AI for health. We call it augmented intelligence rather than artificial intelligence. We've looked at a range of applications. It's a very exciting area. A second area that we look at is remote patient care or remote patient monitoring. So the ways that we can provide care at distance in our health systems. We look at the use of digital simulations and models as a third area. Everything from digital twins to extended reality through to 3D printing. A fourth area for us is technologies, digital technologies particularly, that make the health system more adaptable and resilient in the context of significant shifts or changes or stresses. Think of the pandemic here. And the last area that we look at is the kinds of technologies that will make it possible for our health systems to leverage the brilliant breakthroughs in biotechnology that will really revolutionize not only how we care, but how we even think about our health and well-being. In our health system, we have to constantly be balancing the urgency of reform in key areas, but also the need to be careful, to be cautious, because the stakes are so high. In healthcare, as we know, we cannot experiment willy-nilly. There are real patients in real care facilities and contexts that we need to be mindful of. So the aim of our report was to do a few different things. The first thing we wanted to do was inspire and make clear where are we going and where should we be going as a health system. We wanted to explore examples of where people are already striking out in those kinds of directions to make it real, in a sense. And then we wanted to give guidance about the kinds of activities that health system players should be taking in this year to get ready for and bring forth that future. A crucial part of that for us is that different of these technologies are at different levels of development. There are many AI applications that are out there in the market. The question is, how do we bring them together? How do we make them cyber secure? How do we make them resilient? How do we make them safe? The same thing could be true about remote patient care. All kinds of terrific technologies. Some of them are already deployed, but do they speak to each other? Are they resilient enough? Are they secure enough? So part of what we as an alliance are focused on is how do we take these technologies that could have a breakthrough effect and impact in health and experiment with them in safe ways. And that's where things like the RMIT-Cisco Sandbox come in. It's a simulation environment where we can try and play with different technologies so that we don't need to roll them out tomorrow at scale in a hospital. We can experiment with them, show how they work, see what works, see what doesn't work, see what needs to be improved. As a second step, we can then work with a hospital to engage with them, or a health service provider of any kind, to engage with them and integrate with their existing systems. And then finally, we can try and prototype in situ in healthcare contexts and facilities. So step by step, we de-risk, we explore value, and we produce the kinds of interventions that can have a meaningful impact, not a sugar hit for reformists.